So I have no problem with relaying my experience, and it's been all positive. Dr. Johnson, Dr. Ross, Dr. Robinson, that was real comforting to my wife to have. I was going to be under for 4 hours here, and to have a anesthesiologist, very award-winning or high up the food chain here is very comforting, rather than have something go sideways. So yeah. About 5 months ago, maybe 6, time flies, I woke up on a Friday morning with severe toothache. And I had been derelict and procrastinated for my life with my dental hygiene. And my wife's dentist was closed or wasn't open that Friday. They were able to get me an appointment upstairs from here at that time, Dr. Bishop. I did get there about 11 o'clock on a Friday. They took some x-rays, but they could not do anything at that point for my pain. That's what I was most interested in. So with the x-rays, they sent me down here to Dr. Johnson's office, and that began the journey. I did get the amoxicillin for my pain, but at that point, Dr. Johnson explained what real process or what real alternative I had with my mouth the way it was, which was not good. And we came in about a week or 10 days later with my wife, who's a nurse, because the first time I met with Dr. Johnson, I was in pretty bad pain, so I didn't remember a whole lot. But with my wife here, it was explained to us with my mouth in full picture on the screen, and we began the journey of where this was going to take us. Everything was transparent. The staff, Dr. Johnson, having an anesthesiologist with Dr. Robinson, and then Dr. Ross coming in, doing this, was, again, flawless, I guess, painless, which I know is probably a big question. I had all my teeth removed, and there wasn't any, terrible discomfort when I came out. When I did have my temporary go in, which was the next 2 days later after the surgery, I went to a football game that night. So now I'm about 90 days out, and with Dr. Ross and what's going on in the field of dentistry, I wouldn't call me a guinea pig, but I've got teeth that I guess what was called as a Ferrari or Maserati or whatever you want to call it. I'm really happy, and it's life-changing. You can look at certainly testimonials, or you can sit and have a long conversation with Dr. Johnson and his staff and ask as many questions as you want, feel as comfortable as you want, and actually, if you want to talk to his patients, I'm one, call me. I'll answer questions because I've had it done. Is it going to take away all the angst or whatever? Maybe not, but don't be scared of this. Don't be scared of this. Now I'm going to go have I will say this, the one thing in the last couple of weeks, knowing that I was coming here for this, I've been putting together a list of what food I can now eat. I mean, prime rib or steak or corn or my favorite foods. And so I'm really excited that yesterday the first question I had to Dr. Ross was, when can I go eat? He goes, you can go eat now. So I'm going to go eat tonight.